Hi, this is Dr. Anjali Agarwal, consultant physiotherapist and a lifestyle consultant. Today, I'll be talking about movement and posture during the lockdown for kids and teens and children. We know that lockdown has been quite a long time for all the children who are stuck at home with online virtual classroom or virtual playground or virtual socializing. It takes a toll on their bone health, their mental health, and their physical health. So myself, Dr. Anjali, would be touching on brief periods of time on the issue, which is quite a matter of concern for all the parents and the school teachers and the principal. Everybody and every school should take an initiative to enroll their students into a program where a physiotherapist like us or like me would be able to assess the posture of the kids and would be able to help rectify those postures through the online medium also. So, touching on the basic points on postures, I'll be talking about why it is so important that we talk about posture at this time. Basically, postures are our way of handling a situation, or the way we stand, the way we move, the way we talk, the way we handle our things in the kitchen, or as we grow up as a kid, are into a lot of things where posture is the most important thing to look at. That's myself, a brief introduction about me. You can get into more details about me from the later on slides. And I've been a physical literacy advocate for Pulela Gopichan. So I do advise a lot of physical movement, physical activity for small children and for adults. Because if you're active, your blood sugars are good, your muscles are good, your bone health is good, your appetite is good, everything is related to one thing, which is physical activity and movement. So the more movement you add in your day, or more steps you add in your day, the more kind of health you'll add in your day. So always remember, an apple a day keeps a doctor away, a step a day keeps you from falling from sick. Okay. So during the pandemic time, when we are so much talking about immunity, we should be also talking about the ways we can help prevent obesity, which is again another pandemic. Coming on to the topic, it's easier to maintain a good posture habit in children than to fix an adult who has problems. Okay, so when we see and tell an adult, please straight or stand straight, it's very difficult to tell them to acquire a posture which they have never done for so many months or so many years, and they've acquired it as a wrong posture. So it's very easier to lay the foundation for a small child when he's small and young. Posture control is not just from the spine, just not from the muscle, just not from your bones or alignment. It comes from your eye, your ear, your brain. All of them, they work in sync, and together we are able to have a good posture. So when a child is looking at the television, if the child is talking to you, the kind of time he talks to you, all these kind of matters will look at the way his or her posture forms over the years. So in children, as they're growing rapidly, they're adapting. But by the age of 7 to 10 years, the posture is already formed for them. So it's very essential that we lay the foundation of good posture from the age they're born. And it is the foundation is of good movement patterns so that we can prevent something which can cause aches and pains for them from right from the childhood. So it has to start right when their child is born. What do you see in this picture now? You see a young child all leaned into the book and one where his neck is away from the book. In either of the case, in both of these situations, you see the child's spine will get compromised if you start sitting like this right from the child is small. So it's a very paramount important thing when we look at why the child is sitting like this. It's something very crucial to look at actually. The parents always often call me and say that my child is slouching, my child is sitting with rounded shoulders. But what they forget to understand is the child is always aping you. The child is pictures you as a person. And the way you stand, the way you sit, the way you walk, the child will acquire that. So you are somebody who is a great teacher for your child for good posture habits. It is called good posture hygiene. Now, the good posture hygiene, the way you ask your child to brush the teeth, to gargle the mouth, or to eat the food or chew the food, similar way, every parent has this duty to teach their child something called as posture hygiene. Now, if I enter a room where I'm all slouched, do you think anybody will kind of draw attention towards me or would feel empowered looking at me? No. The moment I open my arms and open my chest, my posture is all good, my eyes are firmly placed, my hips are firmly placed over the shoulders. We always say, stack your bones like a book so that one over the other, the books are there. Similarly, if the child's head is not stacked over the hip, his posture is in a curved slouch posture. Now, by doing this, this is again a great reason a child would have back pain, neck pain, knee pain, would be low on the mood, would have less immunity because not able to open the chest to breathe well. So it's very essential in this time of pandemic when ask your child to sit properly, to stand properly, to walk properly, to eat properly. Now, if I'm slouch, if I'm eating, my tummy muscles will not do the right job. The lot of our psychomotor skills depends on the good posture. Now, if I have a good posture where my ears are falling onto the shoulder, my shoulders is well stacked on the hip, my tummy is well drawn in, my neck is firm and straight, this will actually help me to breathe well. It'll help me to breathe better. Now, by doing all these little things, you as a parent would help your child to develop into a beautiful human being, which would have who would have great muscles, great bones, great appetite, and a great immunity because of good breathing patterns, because of the good open chest. Now, ways for you as a parent to save your child posture and spine. Always invest in a good orthopedic mattress where the child can sleep in a proper posture. Many times, child is sleeping with their legs falling haywire or apart. These can give rise to a lot of pains in the body when the body is awake in the morning. Similarly, the baby is trying to lift the bag, the school bag. The school bags are very heavy, but because of the pandemic, the babies don't have to carry the bags. But any which ways, we as a parent will have to tell them the ways to carry the backpack. Be an example for your child. So if you are slouching, the child will slouch. So remember, the game rule is you are the picture for the child. So you are the teacher of the child. You got to be doing the good things. A proper lighting in the room is a proper essential stuff. Always correct the chair and the table height for the child. Always do not let the child sit in front of computer games because you are busy working online. You cannot devote time for activities. Do not let the child be glued to the TV screen or to the computer screen. Go swimming. Swimming is one exercise which will open up the chest, will help to build up the posture muscles. So this is one exercises which I give to all the children, whether or not they have issues with spine, with growth factors, any other issue, because it's a physiotherapy uh, kind of helps to nourish your bones and muscles. And always check with your doctor who's specialized, like physiotherapists like us, who would specialize in looking at the child's posture. And we can say whether this posture is right, what we can do to correct it. In the going future, what are the steps we can give to the child? What exercise program we can give the child to have a good posture? Now, sit and stand tall is easily said and done. I don't want a child to go slouch. I don't want the child to have a soldier-like posture where he's always stiff. That will cause a lot of pain and muscle stiffness in the body. So it's very essential that we keep them active. And between 5 to 15 years of age, the child's 60 minutes of activity in a day is paramount importance. We can do it in short burst of exercises. You can ask them to go take the laundry and put the laundry in the basket. You can ask to go get a bottle of water from the kitchen, and you can make the child do this multiple about 20 times in a day. You can actually ask the child to fill the bucket of water and try to place the bucket little away from him and back into the bathroom. There's certain ways where we can involve the child in a lot of movement patterns throughout the day. Now, tips for starting is very important that you keep your child barefoot. A lot of parents try to let their child wear shoes right when the child is starting from age 1, 2, and 3. That is the framework that is very essential because the foot designs your spine, your posture, your gait, and your way of walking. So a wrong shoe will design a wrong posture for you. So always remember, let them walk barefoot. The more barefoot they are, they would have to help them develop a good posture. Avoid activities which creates dominance. So always badminton, always football, or always driving the the scooter with one leg and one leg is down. These can cause abruption or disruption in the patterns of movements of the child. School bags have to be light and have to be worn equally on both shoulders. Always encourage child to do activities which are there to strengthen the spine rather than doing yogic asanas because many of the child till the age of 10 or 12 are hypermobile. And if you make them do more activities of yoga, it will kind of disrupt their ligaments and will make them hypermobile and would cause posture issues for them. Always encourage a good balance when they're sitting, when they're standing, when they're talking. Always say, okay, let's stand together. So both feet together, push hips together, push shoulders together. These are the words or the terminology which you should be using for the child. Now, this is very funny, or you would say it's not funny. To grow as tall as a giraffe, our friends of the key animal kingdom never had to worry about a posture. You never see a elephant in my clinic or a giraffe in my clinic. Their mother worried about my the child's height is not increasing because they are always out. They are always doing things which are quite active in nature. So as human beings or as toddlers and kids, we became very sedentary, and that is the biggest cause of this problem. There's a pandemic or pandemic which is going on in the small children. Often a parent calls me and says, there's a hip pain, then the neck pain, then the shoulder pain, and there is increased girth of abdomen, which is obesity, sedentary lifestyle, increased back pain episodes, and nagging headaches in the child, painful wrist joint. These are all because too much work sitting online and repetitive motions. Okay, so that's myself, Dr. Anjali. We always look at the child's posture, and the good thing is because we have introduced AI systems where we can study the spine analysis in a very straightforward way, and it's very important to let your child grow as a beautiful human being and not have disruption because of back pain and neck pain, because it takes time for them to be discovered of these problems in the later half of the life. Something called as crooked spine or scoliosis is difficult to treat below the age of after the age of 18 because the spine is all formed and fused and matured. Always reach out to me at 79816 32270 for any other questions you have. The slouch on the couch or pouch on the couch. So if you slouch, you have a pouch on your tummy. So these are the common postures which we see in the kids nowadays. Please say no to this and let your child get active on the floor, sit on the floor, stand on the floor. These are postures which are more helping the child to grow, having better bones. Sitting is next to the smoking. As injurious as smoking, sitting so far is caused a lot of issues with obesity, childhood incidence of diabetes also increasing because all childs have become a couch potato. The common areas of pain with the child can feel is the neck area, the shoulder area, the wrist area, the hip areas. There's no difference left between a child and an adult with respects to pain, areas of pain. Now, earlier I used to see an elderly of 80 to 70 year coming to the clinic. And now I see not even 50 or 40 or 30 year with worn out bones. I see a child of 12 years and 13 years or 7 years coming to me with nagging pain. So what do we say? What do we blame at the moment now? You have horrifying horror stories of postures of child nowadays, sitting in all possible manners and disrupting the whole spinal alignment of the bodies. Now we were Homo sapiens, so we kind of evolved from a monkey into a human being. So from a four-petaled animal, we became a bipedal animal because we had to hunt, we had to cook food, we had to grow our crops, and then we became very evolved. We wanted industries to come in, so become an industrialist, and then we become an engineer to do tools and instrumentation. Finally, after all that evolvement, we are back to being a monkey, being into sitting jobs all around the day, all around the year. So our spine, which is supposed to grow beautifully, bone after bone, stacks like books stacked on each other, it's now all crumbled or it's become like a C. The C-shaped posture will help you, will kind of not help you, would cause compression on your internal organs, would also can cause problems for your breathing capacity. So maximum of the people during this pandemic also have a posture which is compromised, which doesn't let them breathe good oxygen because of the good bad posture. So there has to be a healthy balance in our life. We got to let the child have a sleep time, a nap time, a physical time, a focus time, a time in, a downtime, a playtime, and a connection time. This is the healthy platter which I'm prescribing you. All the parents should give it to your child. Divide your day in this form. If you will be able to do it, I think majority of the posture issues can be addressed in a nice manner. And the key word is always let your child stretch as far as possible. Breathe in and breathe out as much as possible. So move up, get up, and stand often as possible. That is very important for your child to remember. Always start your day or end your day with a posture which your kids can do in this manner. Always add your child with some sporting activity in the day. Maybe in the house you can play around with the tennis ball, or you can play with the racket sport. Take the stairs. Ask them to always take the steps. That's important. And to stand on a single leg and balance their body, very important, and a stair climb. So always ask them to imagine there is a box in front of them. They're lifting their leg up on the box. This will help them to build up the muscles of the hip. Let them jog, run, and move around as much as possible in between their classes. Ask them to go to the washroom, get a bottle of water, come back, go and water the plants in the kitchen, come back, go and feed the birds in the corridor and come back. Go and ask them to get fetch some laundry from the basket and give it to you. By this, you can add mini movement. You can be lovely, you can love your child, but you cannot let them be lazy. That's my one word. I see a lot of parents carrying backpacks of their child. You're not letting your child do the work of their own. You do not let their spine get developed well. So it's important, let them do their own work. Be independent. Let them be independent too. That's my workshops, which I conduct for various schools for posture and for movement patterns to be from the childhood times. And if you have any question, you can ask me. And thanks, that's about me. And these are my contact details. You can reach out to me for conducting your postural assessment online on telehealth classes, and we can correct your child's posture. We can do a steady exercise-based program for them to engage in activities. Thank you, everyone. So that's the key important thing. When your child is growing, you let the child grow with healthy postures. So always remember what you do now is important at the time when they're growing. Thank you, everyone. Reach out to Dr. Anjali for the posture awareness workshop.